Hello everybody. In this video, we'll learn about lacrimal apparatus examination. So lacrimal apparatus examination you will do after examining the lids. So you'll usually present it as lids and lacrimal apparatus, and you will do it for all the cases that you will be presenting. Okay, but for chronic dacra cystitis, if you're given a case of watering or chronic dacra cystitis, you'll examine it in detail, and your whole examination will be revolving around it. So before we go on to the examination of lacrimal apparatus or lacrimal drainage system, we need to know the anatomy, which will help us to understand the symptoms and also what tests are done and how we interpret them. So the lacrimal drainage system consists of the puncta, which are there on the medial ends of both the lids, upper and lower. These puncta then go on the go forward as canaliculi, which has vertical and horizontal part. Both the upper and the lower canaliculi join together to form the common canaliculus, which then joins the lacrimal sac, which drains through the nasolacrimal duct into the inferior meatus of the nose. So any obstruction anywhere can present as watering or otherwise called as epiphora because it is watering due to reduced drainage. Okay, so you can have symptoms of inflammation, acute or chronic, and which will all present as watering. Okay, so now let's go on to examination of the lacrimal drainage system. First is the inspection of the area of the lacrimal sac. Skin over the lacrimal sac, that is area medial to the medial canthus. You will examine the skin over that and look for any, if it's normal or like this on the right side, or if there's any redness, swelling, ulcers, fistula, sinus, you'll comment about it. If it's normal, you'll just say skin over the lacrimal sac area appears normal. Then you will retract the lower lid and the upper lid and look at the puncta and look for if there is any stenosis, inflammation, or pus pouring out when you retract the lids. Then you will do the regurgitation test, which is you will have to be doing it for all the cases, whether it's a cataract case or if it's a case of watering. You will have to do regurgitation test. So regurgitation test, you'll press over the lacrimal sac area and look at the puncta if there's any discharge. So what you'll do, you will press over the lacrimal sac area, which is the area medial to the medial canthus, and look at the puncta if there is any, for if there is any discharge. Okay, so let's just get through with this. So if there is no discharge, you will say regurgitation test or regurgitation on pressure over lacrimal sac area, or otherwise Rowe-Plass test negative. If it is positive, if there is any discharge coming out from the puncta when you press on the lacrimal sac area, you will say Rowe-Plass test positive, and you will comment about what is coming out of the puncta, whether it's a clear fluid, whether it's a mucoid fluid, or whether it's a purulent fluid. Okay, after that, usually this is enough for your any case of examination of the lacrimal sac. But if it is a watering case or chronic dacrocystitis, you will have to know about lacrimal syringing, though you will not be doing it in your case presentation, but you will have to know how to perform it. Okay, so this is performed while we'll put the paracane into the conjunctival cul-de-sac, and we pass a lacrimal cannula through the puncta and into the canalicula, first vertical and then horizontal, and we inject saline. And then we look for what are the possibilities, whether it regurgitates or does not regurgitate. We will look into it. What are the possibilities that happen? So again, you need to know that you have the puncta, you have the canaliculi, common canaliculi, lacrimal sac, and the nasolacrimal duct. So, what are the possibilities? So, if it is patent, okay, you inject. If both are patent, the whole system, lacrimal drainage system is patent. You inject fluid, and it passes through the whole thing, and the patient feels it in the nose. Right, so there is no regurgitation. Patient feels it in his throat or in the nose, and it is normal. The lacrimal syringing is patent, or the lacrimal drainage system is patent. Now, if there is regurgitation from the same puncta, so if you see here, this is patent, but if I'm injecting from the upper puncta and there is a block here, fluid will regurgitate from the same puncta. If there's a block here in the lower puncta, fluid will regurgitate from the same puncta. So if there's regurgitation from the same puncta, you will diagnose it as common as canalicular block. If there's a common canalicular block, so what happens if I inject from the lower puncta, fluid will come out from the upper puncta, correct? If there's a NLD block or any block in the lacrimal sac area, if I inject, fluid will go into the lacrimal sac and again come back from the opposite punctum. So now, if there's regurgitation from the opposite punctum, there are two possibilities. It can either be a common canalicular block or a nasolacrimal duct block. This sac block is very rare because it's quite a big sac. So it's most common. You have to differentiate between common canalicular block or nasolacrimal duct block. Now, how do we differentiate this? We do something called as probing. Okay, or it's done to differentiate between common canalicular block and NLD block. Now, once we see that there's regurgitation from the opposite punctum, we pass a Bowman's probe. Now, if there is common canaliculus is patent, this probe easily passes through the common canaliculus and hits the bone, that is the lacrimal fossa. So the person who's performing the probing feels a hard stop because it is hitting the bone. Okay, so if you get a hard stop, then you know that the block is somewhere lower down. It's at the nasolacrimal duct. If the block is at the common canaliculus, when you're passing the probe, you feel that there's some soft tissue resistance which is pushing the probe. It's not allowing the probe to pass through. This we call it as soft stop. So then we know that it is a common canalicular block. So first, if you get regurgitation from the opposite punctum, when you're doing lacrimal syringing, there are two possibilities. Either it's a common canalicular block or it's a nasolacrimal duct block. So then you'll do probing. If you get a hard stop, it is a nasolacrimal duct block. If you get a soft stop, it is a common canalicular block. So in summary, when you're examining the lacrimal sac, lacrimal drainage system, you'll examine it along with the lids. You'll examine the area, inspect the area, lacrimal sac area, that is area medial to the medial canthus, comment about it. Then perform the regurgitation test, regurgitation or pressure over lacrimal sac area. If it is negative, you'll say it is Rho plus negative and move forward. If it is positive, you'll comment about what type of discharge, and the questions later on will be how would you diagnose where the obstruction is, when you'll have to know about lacrimal syringing and probing. Okay, so if it is normal, always just write lacrimal drainage system examination normal and move on to the next examination, that is a conjunctiva. Thank you very much.